FORA.tv. The world is thinking.
Every other nation on the planet, every other advanced nation on the planet covers all of its citizens and does it. The second most expensive system on the planet is Switzerland's, and they do it for every dollar we spend, they spend about 65 cents.
But
they cover everybody. So so if every nation on the planet were in the same place, then I'd say, yeah, this just doesn't add up. But the truth is, that's not it. We are the outlier. And in fact, the vast amount of money that we're spending suggests that there is, in fact, a vast opportunity to do this better and to do this right. And that's what we're all, House and Senate, really trying to achieve.
I agree, but you're not proposing the Swiss system. So I mean, if you're proposing the Swiss system, we'd have an apple to compare against an apple. You're proposing to modify an American system. And the American system includes budget rules, and I've lived within those budget rules, and I know how maybe they're not behaving that way today. They probably aren't behaving as badly as I did when I was here. But there's an incentive to underestimate it. In the Health Bill, the Class Act is scored as a spending reduction. A new entitlement for long-term care is scored by CBO as a spending reduction. Now, how is that possible?
Well, that's possible over the 10-year budget window.
Right, exactly. You're making my point. It's possible because of the budget rules and the way CBO scores.
But it's also, and we accepted an amendment in our Health Committee markup from Senator Gregg in terms of making sure that the premiums that are collected will put it on an actuarially sound basis over the long term. So in fact, it's possible that the savings actually over that first 10-year window will actually be greater than what CBO scored.
But only in, I got to say with great respect, only in Washington you call it a savings to have people paying basically a premium for 10 years without any benefits in the first 4 or 5. You score that as a savings. That CBO scores it as a spending reduction, even though there's more revenue flowing in than flowing out. That's based for a new. I'm just saying that the baseline here is, I think, there's skepticism about whatever the CBO is estimating, that they actually might underestimate what the actual public costs are going to be.
2 points, Senator. First of all, the only thing we all know for sure about the CBO estimates, that's Congressional Budget Office, is that they will be wrong. It's just a question of which way they'll be wrong. Now, I'll challenge your supposition that they're always wrong by underestimating. The Medicare prescription drug benefit legislation, they actually overestimated the cost. The costs in the first 4 years so far have been well under the projected cost to the federal government. So there are examples that go the other way. Where there seems to be consensus is our whole package is going to have to convince not only economists within our government, but the American people that we are bending the growth curve in healthcare costs, that we're flattening out this inflation rate that is now 8 or 10% to get it close to normal inflation throughout the economy or even flat. And I don't think a bill will pass unless we're persuasive in that effort.
And just remember the 90s, okay? And the 90s, we faced a lot of national concern about the federal budget and the federal fiscal situation. And Congress and the President came together and acted. And in 2000, we were looking at economic projections that said surpluses as far as the eye could see. And it was in those 8 years in the early part of this decade with the tax cuts, with the unfunded prescription drug benefit, with the unfunded wars, where our fiscal situation has gone into haywire. But we have addressed this before, and there's an intense seriousness in Congress to address it again.
And if you look at the baseline and the way the baseline is growing with absent action, we're looking at costs at 10 years from now that are going to be far higher than what we're spending now.
And there's a recognition that if we don't begin to get our arms around this healthcare conundrum, dilemma, crisis, then we are never going to get the nation's fiscal house back in order. But part of it has to be helping those folks who are totally shut out and are facing bankruptcy in record numbers just because they get sick. It's not right.